Lovely. I think we're all live. Guys, I'm going to kick off today's live stream talking about back pain or sciatica when you're getting out of a chair. A lot of you guys that are struggling with back pain find that getting out of a chair, you struggle to stand up, it causes a lot of pain. And this is from a discussion that I was having this weekend with a family member who'd hurt their back. They had some quite bad sciatica and they were struggling to get out of the chair without a lot of pain. And it's something that I've seen time and time again here in the clinic and over the years. And literally within, let's just say 5 minutes, 10 minutes, a little bit of instruction, we can go from being in excruciating pain getting out of the chair to practically no exacerbation of the pain. It's not magic, it's not special, but it does need to be observed, and I'll go through that with you guys right now. So if you have been struggling to get out of chairs, this is going to be really important. There are so many things that you guys do every single day that prevent your back injury from getting better. You've got a herniated disc down at L5S1, or you've got a minor disc bulge at L4-5, or you've got a spondylolisthesis, and you're struggling with that sciatic pain. You have to realize that so many things you're doing every day are unwittingly making the problem worse, re-aggravating, re-irritating that lower back, giving you the flare-up, and then all of a sudden, we feel like we're getting back to square one and we don't feel confident enough to maybe even do any of the rehabilitative work. So the first thing that we're doing, when we're getting out of a chair, and I'll bring this chair down because it's probably that you'll be on a chair that's more this kind of height. The first thing we do is we kind of come out with the legs here and then we go to get up from this position. This makes no sense, right? I'll move away a little bit more. Look at where my feet are. My feet are interacting with the ground. My center of mass is here. So what do? Naturally, you try and get your center of mass over. Look at my lower back. The spine is in the way. Let me move that out of the way. Look at my lower back. In order to get my center of mass over my legs, I then have to fold forwards and then somehow try and get up. This is a real issue. Now, sometimes you're going to be on a box-like chair, okay? So you might not actually be able to get your feet under the chair the same way in which I'm doing there. You might be on something like, let's pretend it's an armchair. This is a bit higher than you might be on, but you can't get your feet underneath. So you have to do something else, right? But I'll touch on that in a second. So the first and most obvious thing is stop getting out of the chair like that, right? Stop having your feet so far away from you. The most important thing we can do to think about here is we want to avoid the forward bending, which compresses the spine, increases loading, and flexes and really provokes those L5S1 and L4-5 segments of the lumbar spine. And then we end up going like this, and then we're like, oh gosh, it's so painful, it's so painful, it's so painful, it's so painful, it's so painful. And we're moving the spine all over the shop. No wonder we're struggling. So what we do instead is we first use our hands on the side of the chair and we shimmy ourselves as close to the edge as we can, keeping our spine still, right? I'm not moving my spine, I'm just keeping my spine still. My upper body stays still. I'm using my arms, take a bit of the load off my spine. Then my feet, I want to get my feet as close to underneath my center of mass as possible. Now, yes, this is going to involve challenging the knees a little bit. And so you can take a wider stance if you want to, and that can really help, right? You get your feet underneath you, and then you push vertically. So you come straight up like so. And then you can walk away. You engage yourself, of course, as you're doing this. This makes the world of difference. And when you're sitting down again, we don't go way back like so. We come close to the chair, we find the chair, and then we slowly lower ourselves down like so. Now, the important point of consideration here is that you are going up on the toes. That is straining the knees, right? And the big problem that a lot of people with lower back injuries down here have is that you were weak and vulnerable before you actually injured the back in any significant way. And if you injured your back picking up your water bottle or something like that, you didn't have a strong back before, which means that it's very likely you probably don't have strong legs. So there's only so long you can go before you start to maybe aggravate your knees a little bit doing this. Now, the good news is if you're doing it slowly and carefully, then you're going to generally be okay. You're not moving in any silly directions or silly ways. But it's worthy of note. You're leveraging the knees and challenging them a little bit more so that your back gets more respite. And this will literally make an instant difference. You play around with it a few times, get that feet positioning right, think about the movement going straight up towards the ceiling, and you're going to find that instead of getting terrible discomfort when you get out of the chair, it's really going to help you do that in an aggravation-free way. Because I talk about it all of the time. This back pain that people get, that they're making the problem worse every single day. And so if this is just one example, People say, well, I don't do squats. It's like, yes, you do. You get out of bed in the morning, you get off the toilet seat, you sit down on it, you get out of a chair, you get into another chair, etc., all the time. And so if you're doing it in a smarter way, you're going to really find that it just cuts in half the number of times you're pointlessly aggravating your lumbar spine. Got a question here, which chair do you have? That is the best. I don't think it's the best, it's just a good chair. It's a nice comfy one. It's one that you can wiggle around on. It goes quite high and my thighs can come off like so. I'll come back to the chair in a minute. Any chair, right? Any chair this principle works with, right? And so once you've done that, you've at least got an understanding of one fundamental action every day that you're just messing yourself up on, right? And so sometimes people get given the exercise sit to stand, right? And they don't even have competence enough to actually do a squat to the chair with good form. And that's something to really bear in mind. So what do we do with this information, right? First, we realize that actually I don't have enough strength to get off my ordinary chair. So I'm doing this kind of hack, if you will, to be able to get out of the chair in a way that doesn't aggravate my lower back. So I can come straight up like so, right? What can really work well if you're on a chair that's not like this one, and you're on a chair like this, as we were discussing on the weekend, was that you can't get your heels under this chair because the chair's in the way. So if you come onto the edge of the chair, you can normally, on the corner, you can normally get your feet under you a little bit more to go up vertically. So that's just a little pro tip for you. So this is why one of the fundamental, and we get questions from time to time on the lives here and from members, what's the best exercise you can do for back pain? And this is one of the reasons why the squat is the best exercise, because that was a squat. That was a squat. And the squat means you can control your spine and move your hips, knees, and ankles independently so you're not messing things up, right? So one of the things that you then need to do pretty early on is you need to learn how deep can you actually squat with good, correct technique. And so you might do a doorway squat, you might do other variations, but what often happens, and we see this from members over and over again, is that the actual controlled squat can only go to here or here, something like that. And you realize very, very quickly that your toilet seat, your car, your bed is a little bit of a way away from where you can competently squat to. So what do we do now? Well, if you've got a chair like this, any normal office chair, you can raise it. And so you use the chair as a marker. Okay, this is how low I can go. And then you practice these. And then after a period of time, you try something a little bit lower, right? Oh yeah, I can do those now. And then you try something lower and you progress on with your squats, for example, over the course of days, weeks, and months to get to the point where you build that capacity, that ability to perform the squatting motion in a way that doesn't aggravate your lower back and in a way that builds the strength and resilience of the lower body. And then with the incorporation of load, builds the strength and stability of the midsection and its ability and capacity to bear load. You've injured a structure in your lower back, these segments down here, which are load-bearing structures. You need to be able to carefully apply reliable amounts of load with reliable technique to steadily strengthen those tissues as they go through the healing process. Oscar said, hello Mike, I did the core workout too. Didn't feel much aggravation, it's been 5 hours. Now I feel so much soreness. Sent a video on the group, is it normal? Oscar, that core workout number 2 is tough. I think that's the one where you've got the side planks, the Copenhagen side planks and the glute ones. I imagine that's been a pretty tough exercise for you. And I just say, have a reflection on how it was and look to perhaps doing the sets 1, 3, 5. But that one's working the glutes on the side in a big way, it's working the adductors in a big way, and it might well be of being a little bit too much in combination with the other things that you've done today. And you're experiencing a little bit of stiffness in those hip muscles, which is limiting the range of motion in the hips, which is aggravating and irritating the lower back. Get stuck into doing some of the work in the core relief work to just manage some of the inflammation. Definitely get the massage going on those glutes, on those adductors, because they will have had a tough workout with that particular core workout. Like, it is a hard one, it's a challenging one. And so just like the first time you get into training any other area of the body, that tightness that ensues as a result of working those muscles in ways they have not been worked at before can be a little bit of a challenge. So definitely get on some of that care of self stuff, Oscar, and I'll have a look at your comment after today's live, and we'll go back and forth in there as well to guide you, but that is a tough workout. I'm surprised you chose the hardest one. That's probably one of the hardest, like, period. Now, did you do the full length Copenhagen side plank pulsed? That's a tough one. That is a tough one. Maybe a little bit more challenging than might have been advisable at the moment. But let me know let me know, Oscar. Questions here on TikTok. Which chair do you have? Yeah, so the chair here, this is a Hag chair. They're a little bit more expensive than you'd like them to be completely honest. But you know, the thing that you want to look for in a chair is ideally that you can bring it a little bit higher. If you've got back pain, right? Or if you're spending a long time in the chair. I would like this one ideally to be a little bit taller. I'm 6 foot, so just bear that in mind. I would like it to maybe come up to here so I could be in this kind of position. That would be really nice because then I've got my legs perched, my legs engaged, but I can rest on it like so, and I can keep my spine quite neutral. You can see there's a bit of an arch there. I can keep myself in a pretty good position, and because it's got a saddle to it, I can actually get my legs forwards and it's comfy, right? I've also got the support so I can sit back on it like so, and this kind of takes pressure off. You can do that with any old chair. The chair should generally have a rocking back mechanism that is on a spring. So you're not having to sit back up afterwards and do a sit-up, which is not going to be ideal for your lower back. Those are kind of the main things you want to look for on a chair. I think most office chairs will be good. If you're using a reasonably supportive chair. The general recommendation that we have with chairs anyway office setups is really threefold. Number one, get a sit-stand desk. The sit-stand desk should be a programmable one where you press the button and it goes up or down. Number two, have a comfortable office chair. I would suggest that this is not really a comfortable office chair. I move around a lot and I'm able to move around a lot because of the kind of work that we do. And so this chair may not be for someone who's having to sit at the office for 8 hours a day and doesn't really move as much. You might want a bit more support in that regard, something a bit more comfortable. Certainly you want a headrest because my head's just going to dangle off the back here. So that's important. And then have a perching stool. So this might be good for a perching stool if you've got a higher version, right? Where you can kind of perch in that semi-standing position. So you've then got a comfortable chair you sit in, you've got the standing position at your standing desk, and then you've got a chair that you can kind of perch on, as I demonstrated a little bit earlier on. You can kind of be perched like so. So you're resting your legs, you're not standing all day, and you've got the opportunity to switch between these different positions. That's really the best route to go. Other questions we've got on here. I had a PRF at the weekend, nerve pain in my leg is gone. I came from a strong active base. Advice on how to protect the lower back going back to the gym after 12 months of sciatic nerve pain. I would strongly suggest building up a foundation with exercises like those we talk about. We talk about the core 5 exercises in the program: dead bug, marching bridge, squat, hip hinge, step up, single leg hip hinge, as well as an additional one that we've added in with the recent upload of the program, or update of the program. Focus on those foundationals. Going back to the gym is just going back to the gym, right? You can do your rehab work in the gym, and the rehab work fundamentally turns into training. It turns into exercise, it turns into strengthening exercises. And so that's the route I would go. Build that foundation first, because that's really the most important thing. And then you can build a load tolerance back into that lower back, and then you can build on from there. Adding other exercises, other things that you want to do, other workout styles, working on the upper body, all that kind of stuff. But I would prioritize the lower back first. Otherwise, you'll be there worried about doing a 20 kilo hip hinge whilst you're picking up 20 kilo dumbbells in each hand to do chest press, for example. Might not be a relevant example, but it's an example nonetheless. I'd probably steer clear of going and doing stuff like hip thrusters and that kind of thing. Diana said constant tension in the lower back and hips. Not sure if it's hip flexor tightness. If you've got constant tension in the lower back and by the hips, people often mean here, around here. It's not, I wouldn't say it's hip flexor tightness. That's a very reasonable presentation for someone with a lower back injury. And so I would act as if it's a lower back injury if it's been going on for a long period of time. And I would suggest that we're constantly doing things that are aggravating that lower back injury, hence the symptom presentation. Because most people, that when they start out with back injuries, it starts out as stiffness, discomfort, tension in the lower back and buttocks region. And then we assume it's always some tight muscle, some tight hip flexor. Like that. You can very easily rule out the tight hip flexors. Go and lie back and do what's it called, Thomas's test, right? I'm not going to be able to do this very well, but it'll be good enough for you guys to get an idea. You sit on the edge of the bed. Obviously, this is not a bed. You hold one knee and you lie back, okay? If this leg lies flat, then you have appropriately flexible hip flexors. If this leg is floating in space here, then you have tight hip flexors. It's very likely that as you lie back, you'll just be like so. So you don't have tight hip flexors. They might be tense in the moment, but they're not stuck, and you're stuck unable to straighten out, right? And significantly shortened, right? They might be tight and weak, just like everything else. So something to bear in mind there, Diane. William has said, my physio told me to avoid any extension, but noticed a lot of videos promote spine extension for herniated discs. Could you please talk about that? I have a herniated disc at L3-4. Yes, so you'll see a lot of things talking about doing the Cobra position. The Cobra is a backward bending movement. And a lot of people with herniated discs, I'd suggest maybe L3-4 might fall into the category where this will feel nice. But it's not rehabilitating you. We did a full podcast episode on the Cobra stretch and talking about this. So when you do a backward bend, it is what's called an extension compression, meaning that you're just kind of doing that. There's no elongation. Now, yes, it does stretch the front part of the vertebra, but it doesn't have the same elongation. We talk about doing the towel decompression, which is notably very, very different. Because although the towel has a little bit of backward bending, it supports towel, it's also pressing transversely through the spine. So pushing this, think about pushing the length of this column, which is fixed-ish, and pushing it from lane 4 of the Olympic running track into lane 8, right? It's a longer distance, going all the way around lane 8, then going around the inside on lane 1, shorter distance, right? That's why they stagger the starts. And so when we do towel, for example, because we push up like so, and we're getting an elongation, which doesn't happen when we do a simple backward bend. The simple backward bend is just bending backwards. It doesn't get that same elongation as using the towel decompression. What the extension movement or the Cobra, the backward bending is doing, I would argue, is testing for any issues with the extension motion. Now, there could be a number of reasons why you can have issues. Well, not that many, but only a couple. Number one is that you might well have a little bit of disc bulge or disc herniation in that hole. So when you bend backwards, you will see that you make the hole smaller, right? You can see the hole there, bigger, smaller, right? So if there's a bit of disc in there, and obviously there's a bit of nerve and other vascular tissue, as you make the hole smaller, it can pinch and create some immediate sciatica or aggravation of the symptoms. So that's an answer that, no, we're not ready for that. Or it's painful in that range, so avoid that. In other scenarios, you get a bit of shearing backwards. This is more common at L5-S1. You get this retrolisthesis that tends to occur. And so when the person is bending backwards with the Cobra, they're just shearing. Whereas when you do the towel decompression, for example, it's supporting the backward bending curve in a very different manner. It's difficult to fully explain that without getting too technical. However, when we think about any of the bending or twisting motions, because a lot of you guys, we talk a lot with our members about not doing forward bending. Avoid forward bending. It is not helpful for the recovery process. But then you might go into a clinical environment and be told to do a forward bend. Just like if you've injured a meniscus, you go into the knee surgeon and they do a provocative test. They are testing, pressurizing, challenging the meniscus. And that's what you're doing when you have that examination process. The person is testing how you do on flexion. It's an evaluation tool, just like with the knee meniscus example. And so that doesn't mean we go and do evaluations multiple times a day, endlessly for the next 6 weeks. No, we don't need to. If we've tested the extension and it's okay, great, awesome, leave it. We don't need to keep doing it, right? Something like towel decompression is better. And then focus on rebuilding strength and stability instead. That's the way that I would go. I obviously wouldn't be doing forward bending as well because that comes at a cost. But with the extension, it's like, you have to ask yourself the question, how is this contributing to my recovery? What are we trying to do? When we're talking about recovering from back injuries and back pain and sciatica is caused by a back injury. And so that's the thing we focus on, whereas too many focus on the symptoms. You focus on the injury and then the symptoms get better. So what are we trying to do here? We're trying to improve the health of those tissues, the load tolerance of those tissues, because they are load tolerating tissues. And that's how they failed. And so how does the Cobra contribute to improving the load tolerance ability of those tissues? It doesn't. It doesn't. How does doing your squat contribute to that? Well, it's teaching you how to move. It's steadily applying more load safely. It's reliable. It's repeatable. And therefore, we can use that as a measure of improving our ability to bear load. So that's how the rehabilitation exercises work to build the recovery and support the recovery process. Some more comments here. Oscar said, is the curls to shoulder press have to do a single arm? Yes, Oscar, I would definitely be doing a single arm. The big concern there, especially if we've got a degree of vulnerability in terms of our spine, for example, I'm thinking about those dead bugs that you finally got the right variation on, is that when people do the curl and press, so part of the reason we're doing them, and this is a more advanced one, guys, is asymmetry. We're working the body, but we may as well get some core work on at the same time. When we're doing the single arm, there's an element of stabilization that needs to take place. It works nicer than doing double arm. When you do double arm, the tendency will be to arch backwards like so. You will jar your lower back. It also means you've got less load on the load total. If I'm doing double arm, then of course, now all of a sudden I've got double the load, right? Yeah, it's more efficient on time, but you know, you've got plenty of time. Oscar, I'm thinking of you specifically here. Others maybe don't, right? So you do need to be a bit more bang for your buck. But this isn't a back rehab exercise. It's just got additional benefits for the back if we're doing it at the right time in our rehabilitation process, which is later on. And so doing the curl and press one arm at a time, I think, is just much better. It's much, much safer, much, much less chance of trouble in both the lower back and the neck when doing it. So that would be the way I would do that. I would not be doing the curl and press double arm. That way you're getting extra core balance and benefit as well. What else we got here? As Ed said, my sciatica intensity is decreasing. I don't have any pain, but pulley stretchy feeling if I lift the leg sometimes. Twitching my calf. Zed said, so this is a very good question at the end here. I don't really know if I'm getting better or worse. I'm doing my rehab daily almost. You measure your progress on the rehab by your progress through the process. One of the things, like, we put a lot of information out there free for you guys, and we do these lives, and we talk about the core 5 a lot as a mechanism for you to build strength and stability. But you have to progress through the process, and that's the thing, I would check out the program. That would be my biggest suggestion. Check out the program so to make sure you're actually progressing rehab. But you're progressing when you started out doing bodyweight squats and now you're doing, the 36 kilo kettlebell in the corner. That is how you know you're progressing. And as you go through that process of progressing, you become ever less vulnerable to injuries, to flare-ups, and to issues as you're going through that process. So that's a very important thing to be mindful of. We got people over the years, many, many times, where they're actually doing some of the right exercises to strengthen their back. But strengthening is an outcome of performing the exercise in the right way across time. And so if you can just do 10 squats and you're doing 10 squats every day, you're doing 10 pitches every day, that's not going to build your strength and stability. It needs to evolve over time. Remember, there are 3 kind of parts to this strengthening process to help your backs get better. The first part is that you must have a mechanism for being able to approach the exercise with technical skill. I do it properly without aggravating your back. So for example, the squat, not rounding the lower back, knees not wobbling all over the shop, finding an appropriate depth that you can do competently and reliably. That's the technique. By the way, this is the same whether you've got a back injury or you're just trying to get into gym. You must first start humbly with lighter weights, almost ridiculous weights, and getting, or maybe even no weight, maybe even assisted, to make sure that you can do the exercise correctly. Once you know you can do it correctly and you know how you might fail to do it correctly, your bum tucks under a little bit, etc., then you start increasing the difficulty of that exercise over a couple of sessions to challenge yourself to the point where you are struggling to maintain that effectively. This is about finding the effective dosage of exercise for your current lower back capabilities. Now, for someone, this might be 5 kilos on a hip hinge. For someone else, it might be 27 kilos on a squat. It really varies, and this is very, very individual. But you have to find that point. Then you've done the work, which might take months. It might take a couple of days. It really depends on one individual to another, their training experience, although sometimes their training experience can be a negative because they think they're maybe better than they are and aren't aware of some of these blind spots. Chronicity can also be something that makes it harder and you don't realize that you're actually getting away with some technical errors that you won't get away with later. But once you've found the correct technique and you found the right loading that you need to use at the present moment, you then need to train at that load for a period of time and increase that load to get adaptive change. Points 1 and 2 are the work that allows you to spend months and the years ahead building the strength, resilience, and health of your lumbar spine safely and effectively. If you don't do 1 and 2 or fail to do 3, you will not actually make any progress on this department. That's not to say your body won't try and heal and patch up, but you'll find you're stuck in this perpetual cycle and loop of feeling better, then going and doing something and having a silly old flare-up, and then feeling better, going and doing something and having a silly old flare-up, because you're never actually getting out from the healing and patching up to the remodeling and strengthening of the tissues, because that is an active process that you have to drive. And unfortunately, for so many people, that active process that is driven by you needs to be done when you start feeling better. And when you start feeling better, you want to do all the fun stuff. You want to do, quite frankly, the stuff that got you into this place in the first place. And the back pain, well, that's no longer a pain, it's just an injury, and it seems like it's recovered. And by the way, we're all guilty of this. I probably haven't been doing enough stuff on my knee as a result of the meniscus injury, because we've been really, really busy. So I definitely empathize. but try your best. That's all we can do. Try your best to be consistent and make sure that you are continuing on the rehabilitation and strengthening process. Just looking at some more comments coming in here. What do the symptoms suggest as a whole? The symptoms aren't, don't get too caught up by the symptoms, guys. Like, and I say that as responsibly as possible, right? If you have red flag symptoms, emergency case symptoms, you need to go and check those things out. You need to make sure you get that checked out with urgency, right? Loss of bladder and bowel control, saddle anesthesia. You've had a significant trauma, like you fell out the window up here onto your back and then you had sciatica or back pain. You need to go to the hospital. Don't go on a program, right? You go on the program after, right? Get things checked out. There's no significant damage been done. But the overwhelming majority of you guys will not experience that. And therefore it's like, oh, well, I'm getting pain after 1,500 steps as opposed to 1,250. Like, that's irrelevant to what you need to do from a rehab point of view. Acknowledge it. Yes, okay, great. I can walk for 1,500 steps. Cool, right? That doesn't inform the rehabilitation process one bit. It's just a measure. It's just a measure. And people get too tied up looking for significance in the symptoms that they experience from one moment to the next, when they're hugely variable from one person to another. And that prevents them doing the rehab work necessary because we're so interested in those variations. Once you know it's injured, you need to set the target. The target is get yourself to, and this is a long-term target, which is why I put 3 targets for your back health up. 20% of your body weight, 45% of your body weight, and 100% of your body weight. For ladies, 75 to 100%, right? Those are the targets. Until you've got to that point and you're able to squat and or hip hinge 10 reps for 5 sets without any trouble, you are going to have flare-ups from moment to moment. You're going to have variations in symptoms. Many of you will be aggravation-free and feeling great long before you get anywhere near those kind of levels. Normally in this kind of range, 20% to 45%. People will start to, really not be bothered by things anymore. But until you're at this point, observe the symptoms that you have, take note, and carry on. It's just part of the process, right? It's just part of the process. You know what's wrong. You're making progress. You're quite clearly not there yet. It's like me being, I can't bench press 140 kilos, right? I'm working back up to try and get there. Today I was doing 120 for 2 reps. Last year before Celestia was born, I was doing 120 for 5 to 7 reps. I've got some work to do. I know I'm going to have trouble lifting 140 kilos. It's not going to happen, right, on the bench press. I'm just trying to make it relevant to me for simple numbers because it just makes sense, right? But I can't do it. Aggravation-free, I would have a significant injury if I tried it, right? But once I'm there, I'm there. But the only way I get there is to do the doing. And it's going to take time. And so I'm living in the real world in that time. Unfortunately, you've got a back injury. You're living in the real world exposing your back to stuff. So just observe the other stuff, but know you haven't reached the standard, if you will, yet. And so that's the thing that you need to really focus on. Christian has said, what is your view on those plastic back stretches? They seem quite an extreme curve. So we're talking about these kind of stretches that you have. They're actually not extreme enough in many ways. We've got the Denneroll over here, which is a much more extreme version. This is what we use for spinal remodeling. I'll show you guys what it looks like. So you'll see the difference. If I show you guys the towel is great. It's a great exercise. If you've got a lower back injury, you've got sciatica, the towel is an absolutely fantastic one. Don't do it like this, but because I'm obviously on the step here, but you do it on the floor, on a flat floor, and you're like so. You can see it supporting my lower back arch. It's not too big, it's not too strong. Now if we contrast this with this here, okay, you can see this is a hell of a lot stronger, right? My bum has clearance. It's all of the weight of my bum and my legs is pulling my spine, getting that stretch, that elongation of the spine, and opening out the disc spaces on the front. This is used for spinal remodeling for long durations. You shouldn't be using that unless you've had measurements on your spine to know whether it's necessary or not. It's not the kind of thing that you use without any kind of clinical guidance or clinical measurements. However, those back stretches that you get online, they're like 25 pounds, something like that. You might find them exorbitantly priced at like 40 to 50 pounds or $60 or something like that, but that's, I would argue, another conversation. But we've done a video on those. And often the curve itself is just way too steep. And often, and this really infuriates me, if you look at the spines that sometimes they use on the advertising of these materials, they use the thoracic spine instead of the lumbar spine, or they've got a neck on there. Like, it just shows the severe lack of care of some of those companies that sell these kind of things. They're just flogging them to flog them. I don't think they're actually that great because the curve is too broad. The lumbar spine should have most of its curve running down in the lower section L4-5 to L5-S1 is where the bulk of the backward bending actually takes place in the lumbar spine. And so it needs to be focused. That's why we roll up the towel and put it down here. And those back braces, they tend to run all the way through into like the mid-thoracic spine. And that's not the shape of the spine. So you're putting the wrong shape in that place. So hopefully that makes sense, guys. Just coming through some more of the comments. With the towel decompression, I don't feel stretched so much like before. Is that normal? No, Oscar, don't add thickness to the towel. The towel is just there to support you. When you were earlier on in the recovery process, it can be quite noticeable, but as long as you're using the same size of the towel, unless you've grown by like 6 inches or 12 inches, Oscar, you don't need to change the shape of the towel. Just use it. What you'll notice though, from time to time, this is from personal experience as well, is that when you've had like a hard loading session on your squats or on your hip hinges now, because you're pushing on with the weight, you might notice it's a little bit more sensitive, right after doing it. You might notice it's a little bit more relieving, but keep the same thickness. That is a care of self activity more than anything else. I'm just going on to some of the comments on TikTok. What have we got here? And guys, if you are struggling with lower back pain, obviously we're doing these lives to help you guys, but if you are struggling and you've had your back pain for a long period of time, you've had the sciatica for a long period of time, those of you guys on TikTok, check out the link in the profile page. Check out the link up there and have a look at the video. It explains a little bit more about the program. Like, you don't need to carry on doing this on your own and struggling. I would strongly suggest checking that out. And those of you on YouTube, guys, I've just pasted that into the chat as well. There's a link there to have a look. So some of these questions, Sarah has said, I have a degenerative prolapse, degeneration and prolapse of 4-5. Are all the exercises in your program recommended? Yes. Sarah, that is kind of a archetypal diagnosis that a member might have, right? L4-5 and L5-S1 injuries make up 95% of back injury, of back pain, sciatica, those kind of things, right? Those are the kind of things, and everybody has different symptoms, right? One person with an L4-5, with exactly the diagnosis that Sarah has here. One person with L4-5 might have pain going a little bit into the hamstrings. Someone else might have it a little bit in the buttocks. Someone might have it going down a little bit further, right? Some might have a little bit of L4-5 with a little bit of L5-S1. The important thing to understand here is that all you are able to do in your rehab, and all you need to do, is learn how to control and protect this area, and then steadily apply load carefully over time, over the long term. As we discussed earlier, you've got to get the technique right and that kind of stuff, right? But that's all we can control, okay? The spine is very different from my lower limb, right? In my lower limb, I can bend my hip without bending my knee. I can bend my ankle without bending my knee and my hip. I can bend my knee without bending my ankle and my hip, etc., etc. I have joint control. You don't have joint control in the lower back. You can only brace the area between the rib cage, up here, and the pelvis, down here. All you can do is create stability in this region. And that is what the program is helping you do. Now, you've got some other strategies to set off, or rather, offset the strain of daily life. These are the relief-based protocols. We call them the core relief work, which you run alongside your rehab at the same time. But all we can do is stabilize this section here. That's all we can do. And then steadily over time, we are rebuilding strength, stability, etc., to build back up the resilience in that area and support the healing process. Sorry, but the important thing to understand is your body is naturally healing every single day. It's trying to. With education, which is an essential part of the program, and with the right sort of exercises to build that resilience back in, we can stop making things worse, start supporting the recovery process and creating more protection, and then drive that recovery and adaptation process to strengthen up these discs again so that they are more resilient to injury in the future. And everybody start, like a lot of the stuff, it's all like you start that out at home. You don't need access to weights to begin with to do the essential kind of phase 1 work. Phase 2, we talk about using literally household items. You can use a bottle if you want to do your hip hinge, right? It doesn't matter because the phase 2, we talk about incorporating a load so that you're learning the choreography. And then it's phase 3 and 4 that we start building load. Now, yes, in order for you to properly rehabilitate, you need access to some kind of loading. Now, we have a lot of members that just use bands and weight and adjustable weights and weighted vests and things like that at home for long-term progress. Other people that are actually, do you know what, it's good if I go to the gym because it's around the corner and I like the social and it's great to get back in the gym. That you can discuss as you go along, whatever option works for you. But the exercises can all be done at home or in the gym. And I would strongly actually suggest to all of you guys, please, like the whole point of those core 5 exercises is that you don't need barriers to stop you doing them, right? You don't need to wait until you get a gym membership. A question higher up, what about the back extension chair thing, machine? I saw that. Where was that? Where was that question? Zach said, on a hyperextension bench, I'm assuming we're talking about this, right? You don't need complex pieces of equipment. You just do the core 5. And Antisocial has said, what is the core 5? Dead bug, marching bridge, squat, hip hinge, step up. Those are the kind of exercises that we use, because on every single one of those exercises, there are easier versions of it you can do, no matter how bad you are. You can even do some of them on the bed instead of the floor, because that is appropriate, right? If you can't do a squat like this, like if that's all you can do on a squat and your hip hinges like that, how are you getting on the floor without messing your back up? So you've got to do it on the bed. But everybody can do that, right? And so the squat, everybody can do the hip hinge, you just stand there, right? If you need complex pieces of equipment or complex memberships to start the process, that's a problem, because it's a barrier, and then it doesn't get done, and then we feel like we can't do it. Do we recommend sleeping on the floor? No. I think right now, the hardest thing you will find is getting up off the floor, and so that would not be the time to take up floor bed sleeping. I would not recommend that, not to start with. Tamid has said, I need phase 3-4, but I can't find any program. Yeah, Tamid, get into the program. Go and link up in the profile page. Go over there. There's a video that explains a bit more about the program and get started. But make sure that you do the basics first. Any of you guys that do join the program, make sure that you go through phase 1 to phase 2, phase 3, phase 4, because everybody goes through this kind of stuff, and that early part is learning technique. Everybody needs to learn technique at a different rate, and it's different for everybody. And that's the great thing about the program, because we have support there. Some of you guys really struggle with the ability to engage your core when you're doing a dead bug, right? And that's something you're really going to need to work at. You're just not very good at it, but you need to learn it. And so that might delay you moving on a little bit. Other people, they're really good, but when they start adding some load, they mess things up. They can't quite balance correctly, etc. So they need to work a little bit harder in those stages of the process. Some people have a real challenge with actually working out at the right intensity. There's a lot of you in that category. And so you need a bit of help there. Very important. What else have we got here? Phase 1 to 2 has helped me learn the choreography and relief protocol. That's awesome. And then get working on phase 3. If any of you guys, because I know some of you guys are members that join on the lives, right? Get into the members group, post a video, post an update. Let us know how you're getting on, and we can guide you a little bit more. What else have we got here? Comments coming in. Sarah said, I have a flare-up now. Should I start when I get better? I would argue the safest time, or one of the best times to start is before you have any injury. The second best time is when you have a flare-up, because the idea is that it helps you stop having a flare-up, right? So we discussed at the start of today's live, getting out of a chair, being painful. Oh gosh, it hurts when I get out of a chair. Literally, that's because you're making your back worse. If you're learning to do squats, etc., learning how to control your core, and you have the relief-based work that's in the program, for example, then you're going to learn ways to stop aggravating your back every day. And like we were having a chat with a family member this weekend, instantly that makes you feel better. Because a lot of the benefit that people have when they start the program, especially when they feel better very quickly, abnormally quickly, right? Even when they've had it for a very long period of time, we're talking about months to years, a lot of the benefit you get is covering the educational material and going, goodness gracious me, how many times am I doing that thing every day right now while I'm in a flare-up and making myself worse? The thing is, you don't know what you don't know. And starting to fill the gaps of what you don't know, you didn't know, you don't know, is really helpful in stopping you, unfortunately, messing your back up every day. There is a significant body of educational material. And also, the other thing to bear in mind is having that sensitivity can actually be an asset rather than a liability. Some of the people that struggle a little bit are those that get away with errors because they're a bit more chronic and a little bit less sensitized. They get away with errors early on, and then they didn't refine their technique because they weren't quite as diligent to the correct choreography as they needed to be. And then they have flare-ups when they start loading. So it's actually not a bad thing. And sometimes having a flare-up partway through forces you to reevaluate some of the technique that you thought was good that actually wasn't as good as you thought it was. So that we can always utilize the current circumstances to work in a way that is advantageous for us getting better. What else have we got here? So Lola said, I ended up in A&E last night, had a microdiscectomy, laminectomy in April. On the left side yesterday, the right side was throbbing, sent me home with naproxen and said it was muscle pain. Yeah, I mean, that's unfortunate. Really sorry to hear that. The thing is, you've got to have the rehab work, right? You have to have the rehab work. So it sounds like we had the microdiscectomy, laminectomy in April. And so many of you guys that have that kind of surgery, you don't get given appropriate rehabilitation work. Like, that's a long time ago. I use the example, because I mentioned it before, of someone I used to train with, or trained at the club I trained, had a surgery on their lower back, microdiscectomy, and they were back competing in jiu-jitsu in like 9 months, because that individual is extremely focused and also has a significant skill base in working out. So was able to go through the rehab, and like you saw them in the gym doing like not silly stuff, but by silly I mean like they were sweating the basic stuff. They were really doing the basic stuff very, very diligently and rebuilding. And you know, so often the rehab is just not there, the support is not there, because too often it's like, this is the problem. You had the microdiscectomy, we removed the problem. That's not the problem. That is a problem. It is a problem that might motivate you to have a surgery, right? Circumstances obviously discussed with your surgeon. But that is a problem in so much as the real problem is the fact that the annulus fibrosis, which is this part here, was intact and now it has been broken. The nucleus that's bulging all the way out here has been removed, but the damage to the annulus fibrosis, which is the thing that load bears, it remains after you've had the surgery. So some people have some night and day, gosh, my sciatica's all gone. I woke up from the surgery, or you know, I got my sensation back and boom, I can't feel a thing. It's all gone, great. And you don't understand that the injury has not recovered. And if you don't get the appropriate rehabilitation work done, what's to make us say we're going to do any better this time round, recovering from the surgery as opposed to the previous flare-ups? Oscar said, when relaxing, I just lie down on my stomach. Is that good? Yeah, Oscar, just make sure that you're not like overly arching the lumbar spine. But yes, lying on your stomach is a position that allows the lordosis to drop in, and it tends to be a little bit better. And I would suggest actually, arguably, perhaps quite good, as opposed to relaxing like this on the sofa. This is objectively not good. Most of all, because when you get up, what do? You go straight up like that, and all that flexion, that load, boom, straight through that L5S1 and L45. Mary has said, what do you recommend for sore pain in the lower back when moving from left to right? Exactly what we've been discussing on today's live, Mary. That is doing the rehabilitation work. We have an injury in our lower back. Just moving from left to right should not be a painful experience for an intact spine. And so there's some element of injury there, and that needs to be resolved. That needs to be supported in its recovery process. And the thing to watch out for is so often people fall into the trap of, oh, I feel better now, my back pain's gone. It's like, yeah, okay, the back pain's gone, but the injury needs to be supported in its recovery process. And that is really important. You need to be devoting some time to doing proper strength and rehabilitation work to rebuild the strength and resilience in that area. And as I've said many times before on the lives, like, there is every chance that a lot of you guys watching this that are struggling with lower back pain can be stronger, more capable after you've done the appropriate rehab than you were before you injured your back. And maybe even in all likelihood, stronger and more capable and more resilient than you were 5 years ago, 10 years ago, 15 years ago, or ever have been. Because unfortunately, like, we forget, because we are into fitness, into health, and into all that kind of stuff. You think that everybody else is interested in that, but if you find someone who's into like niche anime comics, they'll think that everybody in their ecosystem just knows all the latest stuff, right? And you don't have a clue. And so that, you know, there's a lot of people that haven't built appropriate resilience and strength because they're not interested in it. It's not been an area of interest. But now is the opportunity to use that time, use this injury to actually create a greater sense of health and well-being for the long term, and improving the health of your lower back, the quality of the muscle tissue that you have, predominantly in the lower body and the midsection, is so powerful for your long-term health, well-being, and absence of disability, especially as we get older. MC said, just joined your program last weekend and make it one-to-one. You're more than welcome to, MC. 55, my back has gone downhill over the last year. Was squatting with weight just 5 months back. My mornings suck right now. I think the most important thing you can do, MC, is get into the members area, get stuck into the core relief work as you are doing the core phase 1. Focus on finding the right technique on all of those exercises that does not aggravate your discomfort, doesn't aggravate your symptoms, because sometimes the symptoms aren't necessarily that painful. Sometimes people will say, oh, well, it's the numbness in my big toe. And it gets worse when I do the squats, but I don't care about it. It's like, no, aggravate any symptoms. Find the right choreography. The squat is a great example where actually this might have been something that went wrong, right, with the squat. Because we get a lot of members that have done squats, but they might not be doing it right. For some people with injuries to the lower back, when they squat, just like with a rounding the back, just like knee hugs can feel nice, when they squat, the rounding of the lower back doesn't actually bother them that much at a certain weight. But as they start to build the load, it really catches them out, and all of a sudden we get a big problem. Why? Because when they bend over and round the lower back, the holes get larger. So the inflammation that's built up there it's relieving, right? It doesn't hurt. Some people will literally say, like with spondylolisthesis in particular, I squat down and I just stay down here for a little while and then I can go again. That is one of the examples of something that unfortunately feels good in the moment but is making the problem worse. And so for a lot of people with the squatting, they might not be sensitive with certain lower levels of load to those technical errors. And so you will get allowed to build in a bad movement pattern. Worse still, I've heard sometimes people doing pelvic tucks before they do the squat. These kind of instructions are not good, not helpful at all. And so those mistakes then cost you when you get to a certain level, because it's not very predictable as to how much load is going through that disc when you're adding elements of flexion. It massively increases it in a way that really provokes that lower lumbar spine. So I definitely get stuck into the material, MC, and get into the members area. Give us a little update on how you're going, how you're finding it, any challenges you've got with the rehab exercises, particularly, the 6 ones that you're working on. And then working to expose yourself to load in phase 2, but low loads, just the choreography point of view, right? As I say, holding a bottle, holding a pack of mints, right? It's this is a bit silly, but you get the idea. And then phase 3 is about, okay, let's steadily start to rebuild it. See what went wrong, right? Really important. Oscar, should I do upper body 2 times a week and lower body 2 times a week? My best suggestion, what works nice when you start to get to a good amount of load, is 1 heavier squat day, 1 heavier hip hinge day, something like Monday and Thursday, something like that, right? Spread out plenty. You might choose to do a lighter weight, lower body day afterwards. So like on the Monday, you might do a heavy squat, and then Tuesday, you might do a lightweight hip hinges, working the range of motion. But Oscar, someone like you, you don't need to increase the range of motion on hip hinges, so that might be unnecessary. You might do an asymmetrical day. Maybe you do split squats on a Tuesday, for example. And then yes, upper body, or maybe do the upper body on a, that would be good. And then yes, an upper body day, maybe 1 or 2 times a week. And then, the ab day, if you particularly like them, or maybe you want to do a cardio day. So you do maybe one of the easier ab workouts, right? Not the one you've done this week. And you combine that with some cardio, for example, if you want to work that department. That would be a smart route to go forwards, for sure. And, work on it, Oscar. And if you feel like, actually, no, I do have the capability in the tank of having an extra harder day, maybe on the squats, for example, then fine. Like that might be something you want to do. Maybe you want to do a whole body day. Maybe you do something like, and I'd suggest this might be built up over a longer period of time, but like Tuesday you do squats, Thursday you do hip hinges, and then maybe like Sunday you do whole body day. There's a bit more of a challenge. Like that might be something that we work towards. Awesome, just coming back onto TikTok. And guys, how long have we been going? 48 minutes, gosh, that's gone by quick. Guys, I'm gonna keep going for another 10 minutes or so. If you've got questions, please do post them. If you need more help, check out the link up in the profile page. If you guys have been finding this helpful, make sure you're following. If you're on TikTok or if you're on YouTube, guys, we are doing these a little bit more frequently now. Hopefully they're helpful for you guys. Consider sharing the channel and all that kind of stuff. We appreciate it, definitely do. And all the questions, guys. The questions make it more fun, more interesting, keep me on my toes as well. It's always good to keep on your toes. So please do keep them coming. Lorena has said, random question, but have you heard of a woman having more sensitivity during the period? Yes, that's not a random question at all, right? There are 2 things that often don't get looked at, right? Number 1, ladies that have particularly bad periods. What do you do when you have abdominal region pain? You certainly don't go like that, right? Because it's sore. You're like this. Oh gosh, maybe I have a water bottle here. What am I doing to my spine? What am I doing to my spine? Uncomfortable. Rounding the lower back. It's a good number of women, I can think of a couple, off the top of my head, specifically state that during that period, each month, like that week, maybe for a couple of days of the week, it's really bad. So like don't make sure that you don't try and push your weights at that point. Maybe that's the days that you do lighter work on your rehab, right? If you're in the program. Maybe you do a lighter load day on those days. Just take it easy, a bit more relief work, right? Give yourself the benefit of the doubt. Perfectly reasonable. We cannot get around certain features of biology that do challenge us. Some of you guys are taking strong pain medications, non-steroidal anti-inflammatories, things that irritate the gut, give you constipation, diarrhea, discomfort in this region. Moving on slightly in topic, but similar sort of concept. You're on the toilet. You're not like that. You're like that. You're struggling. You're there frequently because your abdominals, your digestive system is sending you to the bathroom more frequently and you're struggling, increasing strain. These are relevant things. It's things that are holding you back, but you can't avoid them, right? You're going to have a period. You're a lady, right? You got some consequences of the medications that you're taking and it's affecting your digestion. Understand those are reasons why it's more difficult. You're not broken in terms of like, there's nothing wrong with you per se. That's perfectly normal for those things to be a problem if you've got a bad back, right? Imagine you just broken your leg and you're like, yeah, but I've got to run 100 miles a day, right? And my leg's hurting. Well, I've got to run to work. It's like, well, if you can't avoid it, you're going to aggravate the leg. That makes sense. It's reasonable. The problem is sometimes the connection between these two things. For example, going back to Lorena's question about, more sensitivity during the period, more discomfort during the period perhaps, more back discomfort I'm talking about during the period, more sciatica during the period. Like, you think that's abnormal, but it makes complete sense. And just being told that is like, oh, it's not up in my head. It's not all me. It's actually a logical response to having slightly more painful periods and the discomfort positions that I get into, right? So hopefully that makes sense. Hopefully that helps. The Aussie lad said, I'm a truck driver and sit down a lot. You've got to do the best you can, right? You're going to get symptoms as a result of the disc injury or the injury to the lumbar spine, because when you're sitting, you're putting anywhere from 20% of your body weight to 45% of your body weight extra through the lumbar spine. Technically speaking, I talk a lot in the past about 40 to 90%. You increase the spinal loading by 40 to 90%, which is generally speaking half of your body weight is on your spine, hence why the numbers are slightly, I've changed the numbers around a bit when quoting that to make it the maths a little bit easier for you guys, or a little bit less complicated, because sometimes it's just a word vomit and it gets confusing. But what you want to do is do your best, right? Acknowledge that you've got a job where you're having to put more strain through the lumbar spine than would be ideal, and do the best you can, right? You do your relief work, you make progress on your rehab, and you will observe as you progress that sitting in the truck gets a little bit easier. You try and recline the seat a little bit, you try and use a little rolled up towel behind your lower back, you try and get your thigh angle to go away from you rather than up like so that lessens the strain on your lumbar spine. You try and take more regular stops and get out and move around a little bit more. Those kind of things will help. You do your best, in other words. Oscar, I would not use an assisted pull-up. Use a lat pull down instead. It's way easier, way less moving parts. My physio said I have an L2-3 nerve root irritation and has given me some mobility and strength. Just make sure it's not spinal mobility. Like, the one thing to bear in mind is that when you're doing rehab, it needs to all be coherent in terms of the objective, right? And so we have an injury to the lumbar spine. If we're doing the right stuff, such as, for example, strengthening work, squats, hip hinges, done with correct form, done aggravation free, but then we're finishing our session up with something that violates that same principle, like static flossing or hugging the knees, that stuff doesn't make sense. It's contradictory, right? I can't lose weight if I eat a salad and meat all day and then go and have like dessert in the dinner, in the evening, like, or gorge myself in the evening on sweets and that kind of stuff. It's not going to work. We're going to end up creating trouble. We're contradicting. And so the good stuff that you do can actually be undone if you're finishing the session and then doing some quote unquote bad stuff, right? Oscar said, I mean pull-ups. Yeah, do pull downs. Do pull downs. Do that lat pull down machine. It's much better than doing pull-ups. I'd leave them out for the time being. So that's really important to understand. Make sure that your rehab that you've been given doesn't include stuff that is like knee hugs, child's pose, sciatic flossing, knee rocks and all that kind of stuff. Because even if it includes the right stuff, the point is that doing that wrong stuff is aggravating the underlying issue. So if you're doing a bunch of good stuff and then just undermining it with the bad stuff at the end, it's not helpful. Apart from the sciatica, I had a hip replacement recently, limit on stretching. Yeah, you need to be careful with some of the positions like that right after doing the hip operation, so you want to be mindful of that. What else have we got here? Thank you, Ozilab, appreciate that. Thank you for the super chat. They don't come up on the software we use as well, so I can't see them as easily, but I really appreciate that, thank you. And guys, we're getting towards the end of the live now. Last 5 minutes, so if you guys do need any more help, like definitely check out the link in the profile page. Those of you on TikTok up here. If you're on YouTube, you can check out the link in the comment. I've just put it in there again. Like, you don't need to do it on your own. There is a format, a structure that you can follow with support to help you guys get better. Anisha said, if thighs should be lower to avoid rounding the lumbar, why are we asked to put our feet up on pillows to relieve back pain during sleeping on your back? Because when you put your feet up, just like with a knee hug, I'll try and show you guys on the spine. When you put your feet up, you do that. I can show you with this one here, but the effect is down here at L45 and L5S1 most. Look at the size of that hole. It just got larger, right? That's why you guys are given pelvic tucks, why you're given knee hugs, why you're told to lie on your back with your legs elevated or your thighs elevated. Because they are focusing on the problem being the fact that you have pain, not that you have an injury. The problem is tension, stiffness, pressure in this area. And so because there's an injury at the disc, and obviously I mean the ones down here, but you just can't see them as well on the spine. There is an injury at the segment, because if there's an injury at the disc, there's going to be injuries, there's going to be damaged tissue in the other area as well, vulnerabilities, and injury, right? And so as a result of that injury, you get inflammation filling these holes. And if I make the hole larger, it can instantly feel nicer. The problem is by making the hole larger, we are squashing down the front, stretching those tissues that are trying to knit back together again, right? A great example of this that some of you guys might be able to relate to, if you have a cut or graze on your knee, you get to this point where it's healing, you wake up in the morning, you're like, oh, my knee's healed. As you do that, it feels tense, right? It feels stiff on the surface of your skin. It doesn't want to stretch. Then you stretch it more and you rip the scab open and boom, it's bleeding again. And people mistake this stiffness that you get in the lower back for something that needs stretching. Like, you don't need stretching. You don't need stretching. Yes, we do include some targeted hip mobility stretching, but it is of limited value. We explain very clearly that it is temporary in its effectiveness. Worthwhile, but very, very low tier. Worthwhile, but very, very low effectiveness in terms of it's going to tighten back up again because you've still got a back injury there. And the injuries at this level of the lumbar spine, these last two levels, send signals out to these muscles, the hips, hamstrings, etc., and tell them to tighten up. So there's limited value in doing those things. And we have to also do them with a neutral spine, which a lot of people don't do. Habiha said, doing the core 5 but still get pain above the tailbone when standing or walk for too long. Habiba, make sure you join the program. There's a very good chance you're not actually progressing the load of those exercises. We discussed a little bit earlier on. The targets, right? 25% of your body weight, or sorry, 20% of your body weight, 45% of your body weight, and then 100% of your body weight, roughly speaking. Have those as loading amounts, right? So for me, it's 20 kilos, it's 45 kilos, and it's 90 kilos, 95 kilos, that kind of level, right? If you're not doing those, where you are in that spectrum, right, you're probably below the first one. You might be between the first and the second. Make yourself stronger. You need to build strength. That takes time. And it might well be worthwhile, like if you're struggling to do it on your own, check out the program because it gives you more guidance along the way. What else we got? My mum is currently having back pain, making it hard to walk. Can we jog or run if we have the problem? Guys, focus on rebuilding strength and stability into your back. And then as we get to what we would call a phase 3 / phase 4 level of the program, you can start adding in things like running. We talk about getting back into things like running through the treadmill, being the safest and most reliable route back into that kind of thing. But you should be focusing on, like, when you have a back injury, focus on rehabilitating the back injury, not doing other random stuff, right? If the pan on the hob while you're cooking is on fire, don't go and do the online delivery order. Deal with the pan that's on the fire first. Once that's sorted out, you can go and order your Deliveroo, or you can go and buy that thing off Amazon, or you can go and turn the TV volume down. Sort out the problem and don't get distracted, especially in the physical domain. Like, focus on the issue and rebuilding. Spice Latte said, I've had a disc bulge and sciatica for a year. Should I go for the injections to ease the pain or rehab? I would strongly suggest looking at the rehabilitation work first. By all means, book in the injections for a couple of weeks' time. But the thing you've got to ask yourself is, why have we not been getting better up until this point? And a lot of times it's because we're not very good at doing those simplistic exercises. It is almost unheard of, considering the significant number of members that have come through the program and patients that have come through, where someone will come in like, boom, on there, I've got terrible, long-standing lower back pain, sciatica, whatever it may be, and then I go and say, go and do squats on there, and they're like, boom, load up 100 kilos, boom, 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 no problem. That doesn't happen. What happens is that you're not very good at doing these exercises. And when people first start the core 5, they go, gosh, they're too hard for me. It's like, great. Do easier versions and realize you've got a lot of work to do. And the injection doesn't change that. And the fact that we're considering the injection is like, I'm not really sure, you know. Use the sensitivity that you have at present as an asset. Looking for aggravation-free reps. It's bad enough with the lower back injuries. Whenever we injure a joint, we affect the joint proprioception. We have less awareness of where that joint is in time and space, and therefore less control over it. So often people don't even know their back's moving until they look at a video and they're like, gosh, I was doing that. And you're like, yeah, you were. Like, wow, no wonder I'm struggling, right? And so when you, and often all of the only thing that's telling you that is actually the pain, that the back's moving. And so to rob yourself of that valuable indicator, not infallible, but valuable indicator, might not necessarily be the best route, or not a route we want to rush into, if that makes sense. Other questions? PJ said, should you do the core 5 every day for like 5 days a week? So, and the Aussie Lab, I would use biofreeze is a much better option. Biofreeze. You could always use the deep heat on your thighs here and biofreeze on your spine. Hot here, cold here. Because your back's going to heat up when you're sat in the truck anyway for extended periods. Ice is way better for the problem. The reason I say on the thighs is because that might ease the tension in the hamstrings a little bit, which would help the lower back. Should the core 5 be done every day, PJ says. When you start out learning back strengthening rehabilitation exercises, doing them daily, right? We suggest in the strategy, not often, we always suggest. In the strategy part of the program, when you guys start, for example, the core phase 1, the instructions are to get the individual exercises and go and play around with them to figure out what you can do. And you're going to do that daily, but you need to figure it out. It takes a little bit of time. It might take a couple of days. It might take a little bit longer for some people. You need to find out what you can do effectively, and then you put it into a workout. Once you put it into a workout, that workout is generally not demanding physically. It might be demanding up here for you to do it correctly, but generally speaking, it's not demanding physically. As you progress through what we call the program, phase 1, 2, 3, and 4, as we get to phases 3 and phases 4, as I was discussing earlier, PJ, you might have missed this, with Oscar's question, you won't be working out hard every day, so you will have rest days. But in the early stages of the program, much of the benefit that you are making when you start your rehabilitative exercise is actually technical. You're not physically exhausting the muscles. Like people do 10 squats, right? They do 10 squats like this. They don't finish the 10th one and go, oh my gosh, that was so hard. It might have been mentally hard, but if you stood next to them and say, do another 10, they'd be like, yeah, sure. 1, 2, 3, and they do another 10, which means we're not actually working out physically at a capacity. And that's good, right? Because we want to get technical practice in. And so you would do it daily to start, but it evolves. Again, this is why it evolves, right? We put a lot of that stuff out there to help you guys, but it does evolve over time. That's also why we have support in the program. Why are child's poses given if they are bad? That's a very good question. Guys, the reason child's poses are bad is exactly the same as what I mentioned earlier about the legs up, right? The legs up when you're lying down. Child's poses are given because it's based on the philosophy. Oh gosh, Alexa's listening to us. Child's poses are given because the people that are giving them are working on a different philosophy, if you will, right? You'll see it all the time in the terminology, and the terminology is important, and we have to play with that terminology because that's the way people search for these things. People search for back pain, sciatic pain. My back is stiff. They're searching symptoms, right? And so the proviso is that the problem is that the back is stiff. The problem is that the muscles are tight. The problem is there's inflammation in the lower back, as opposed to knee ligament strain. Now, yes, people are searching for herniated discs, but generally, when you go to your osteopath, your chiro, your physio, whoever, it's my back pain. And they are operating from a back pain point of view. They are helping you with your back pain, your symptoms of pain. And so their priority is that there is inflammation down here, there's a bit of this down here, there's stenosis down here, and there's tension on the back here. So if it's tense, we just stretch it. Boom. Knee hug does that, child's pose does that. And if there's a lot of inflammation down here, we just go boom, and it feels nice, right? You go into the clinic, they do some knee hugs, round the lower back, open out this space, feels nice, right? Great. And a lot of people will find that feels nice because they're operating on the pain that you're experiencing as the priority rather than the injury and the problem. And when you realize the injury is the problem, you manage things in a different way. You evaluate things in 3 categories. And I think I'm going to finish this. I'll have a look if there are any quick questions. I'll go through those after. There are 3 categories of relief work. And just as if on cue, TikTok checks I'm a human. There we go. Okay, listen closely. 3 categories of relief work. Number 1, relief work that directly takes pressure off or helps the healing process in the lumbar spine. You guys have a disc injury. We've got something like the bed decompression, the towel decompression. These are things that directly take pressure off that disc that is being squashed. Actually do something to the thing that's injured. The disc, the segment. They take pressure off the segment. Okay? They also do other things, but they do that. They directly work on the injury. Then you have things that are second order in nature. And this might be, for example, the hamstring stretch. A hamstring stretch done as a proper hamstring stretch, not rounding the lower back to touch your toes, has a second order benefit. How does that work? By improving the mobility of the hips temporarily, we mean that the hips are more free, so the lower back has to get involved less, which means that when you're then moving around and doing things, your hips use more of that mobility so that your lower back gets a bit of a break. So it's got a second order benefit. We could put something like contrast bathing in kind of 2 camps, the first and the second camp, because contrast bathing helps calm down the inflammation in the area around this literal spot and improve the circulation in this area. So that kind of has a benefit, but it's also working to ease the congestion in this area, which is kind of like a second order problem. By using the contrast bathing, hot, cold, hot, cold, hot, cold, we're managing the excess inflammation in this area a little bit. Something like walking, aggravation-free durations, would be something that is helping drain the excess inflammation in here, but not really helping the underlying injury. So second order benefit. Then we move into categories which are the third, which are the one that you want to avoid. These are things that feel nice in the moment, but are actually making the problem worse. That would be something like a knee hug. Why does it feel nice? Because you're opening out the space and you create a nice stretch. If you didn't have back pain and you curled up in a ball, it would feel nice anyway. Just because it also feels nice when you have back pain doesn't mean it's beneficial, right? Instead of doing that to ease the tension here, we could use, which isn't around here, a massage gun to work on those muscles and ease some of the tension, which falls into category 2. It's not making the underlying problem worse, but it is providing some relief. And it's not fixing the root cause problem either, so it's a neutral, number 2, right? So hopefully that makes a little bit more sense for you guys. I'm going to leave it there. I'll just have a quick scan through some of the last few questions. Guys, if you need more help with your back pain, go to the profile page, check out, there's a video there. Link on the profile page, backinshapeprogram.com/start. Have a look at the video on that page that's linked in the profile page. It explains a bit more about the program. All the pricing is there and everything else. Have a look. If you think it's for you, join for a month. If you want to join for longer after that, if you want to keep things going, that's perfectly fine. Give it a go, because the structure there, the support that we have in the program itself, I think you guys will find, it's pretty good. It's pretty damn good, okay? Just skipping through some of these last few, see if I can throw out some quick pearls of wisdom. Can you avoid spine surgery with a grade X spondy? Yes, we have a good number of members that come through the program with spondylolistheses of varying degrees, 1, 2, 3. Typically 3 and 4, we start to get a bit more. We need that surgical input, I would suggest, at least for peace of mind, if nothing else. Can you show how to do the hip hinge with Paige? Can you show how to do the hip hinge with weight? I'll briefly show you guys. Yep. So if you got a weight, this will do as a weight. It's exactly the same. Just hold it down here. Boom, hip hinge. Boom, hip hinge. Boom, hip hinge. The weight should be between your legs. Shouldn't be floating over here. We've got many tutorials in the program on how to do that and variations. Spice Latte, how much is the program? It's on the pricing page. You've got options. It can be £15 a week. I think it's like £11 a week if you join for the yearly, but I would strongly suggest do not join for the yearly. You can always just email us. Join in the most inexpensive way possible. And then if you guys, if you like the program, you can always go and just send us an email and say, hey Mike, hey guys, can I switch over to the yearly membership? Because I've tried it, I like it. And then you can save 25%. Any other last ones? We have many members upload, Spice Latte, we have many members upload their images to the program. They'll upload their reports, like, hey Mike, I just got my MRI report back, it says this, blah, 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 blah. And we comment about that and talk about that in the members area, so yes. Can you share what you said about if walking helps? Missy, yeah, if walking helps, walking is a relief-based strategy, meaning that it is, when done without aggravation, because some people will only be able to walk for like 5 minutes, 5 steps, whatever. that little bit of movement is helpful in managing the excess inflammation down here in conjunction with some of the other strategies that we talk about. So it's worthwhile doing. Aggravation free though the walking must be, but it's not fixing your back. Awesome. Guys, I'm gonna wrap it up there. Thanks to all of you guys on TikTok. Again, if you need more support, check out the profile page up here. Make sure you're following. We are going live a good couple of times this week, so keep an eye out for those. And if you need more help, program. YouTube. Thanks so much for all you guys that joined. The recording will be up straight away, so if you missed anything, we'll have chapters and everything else up very soon. And see you guys next time. Thank you very much. And if you came in late, we're probably going live tomorrow, I think. Probably live tomorrow as well. Similar sort of time, I suspect. So thanks for joining, guys. And if you're watching this after the fact, you can always post down in the comments. We do check those out and comment afterwards as well. Thanks, guys. Take care.